Yeah, sure. You're absolutely right. So as a we also have this kind of stereotype image of the postpartum depression. However, as I mentioned before, other conditions like anxiety disorders are also very common in a pregnancy. And also, for instance, eating disorders. So many women, for instance, have eating disorders which can be mild or moderate, and they don't impact so much in their day-to-day level of function. However, with the physical changes imposed by the adaptation to pregnancy, and the postpartum and the breastfeeding, women feel very conscious about their self-image and their body image, and this can actually make eating disorder even worse. So we know, for instance, that many women actually hide the symptom of eating disorder. But again, it's very important to identify these because an untreated eating disorder can have detrimental consequences for the outcome of the pregnancy. Some women may develop also psychotic illnesses, for the first time during pregnancy or in the postpartum. Perinatal OCD, for instance, is another condition which is very relatively frequent in pregnancy. So women become extremely preoccupied with ritualistic behavior and have intrusive thoughts. And of course, there are conditions which are mixed. They have picture with mixed anxiety and depression. Another important aspect of the perinatal mental illness to consider is that the course of the illness it's very different from the course at other time of life. One of the characteristics, for instance, of perinatal mental illness is that the course is very fluctuating, and the progression is very rapid. And so women can become unwell, particularly in the postpartum period, within 24 or 48 hours. And that might take aback a healthcare professional and loved ones in terms of how to manage and how to support and help these women. And so we have to be really mindful that every type of illness can occur in the perinatal mental health, in the perinatal period, and we shouldn't focus only on the postpartum, but also in the antenatal period. And in fact, I think it's estimated that 13% of women who are labeled as postnatal depression in reality had antenatal depression as well. And so, with this in mind, we have to be very vigilant for signs and symptoms not only of depression but also anxiety, perinatal OCD, eating disorder, sometimes psychosis, and also not only, as I said, in the antenatal period but also in the postnatal period. And another important aspect to consider is that women who have had a very traumatic childhood and have suffered abuse, they often struggle to adapt to motherhood. And those women, for instance, also need specific and specialist input to help them to adapt to become responsible and responsive parents.